Dr. Renu, as you are, Ms. Anita there, as you are working with Aga Khan Agency for Habitat India, and you are into, because I am also working with Habitat for Humanity India, where we are doing a lot of construction, like sanitation, housing, and designing is main concern, especially when we want to make it women-friendly or period-friendly toilets, like we call. There are lots of challenges we face. So what is your experience when you do such kind of projects?
So it's a privilege to be here, especially only the three panelists are sitting there, which means we will get a little more time to talk about. And I'll just talk a little bit about my organization. Aga Khan Agency for Habitat actually is in the built environment with the construction work, with habitat, housing, water, sanitation, disaster resilience. So slowly we realize that we cannot close our eyes on a very important issue of menstrual health management vis-a-vis with infrastructure. But once we got into infrastructure, we realized health cannot be also ignored. So it became complete kind of a work for us. Despite being in the construction, in the habitat, we are also into now looking into health as a very important aspect. So yesterday, I think somebody mentioned that we also need to talk about failures. So I will just touch upon our failures in MHM. So in 2010 10 or 11, you might have heard that there was this Mr. Arunachal who was awarded by then our President Shri Abdul Kalam for the low-cost sanitary pet production unit. So we were really charged with that innovation, and we said, let's get into that. And we mobilized our women worker, our self-help group in one of the village in Gujarat known as Dedi Kiara. And we were very happily, we engaged them also in training. Mr. Arunachal, I'm forgetting his full name, but he came there. Yeah, so he came in our villages, we trained our team members, and we were very happy. And it was somewhere in 2012, I'm talking, when MHM was not the buzzword created around this development, the professionals. So we set up the unit, our SHGs were really charged, and then we realized we are not able to compete. We are not able to compete against the market forces, because there are other corporate sectors, there are a lot of other FMGs which are coming with better options. We were not in a position to have a control on the quality, because we ourselves were not expert in that. So somewhere due to a pretty good investment of 3 lakhs at that point of time we did, and we realized we are not enough expert organization to get into that. For 2012, then we thought, let's relook this. How do we enter into this domain of menstrual health management? And then, as usual, every NGO finds the easy way. So we started looking at the schools. So we started our work in 60 schools, and we thought, let's concentrate only on awareness building and also improving the infrastructure. That in our case, then in Aga Khan Agency for Habitat's case, has really given us a very output and outcome-oriented results. So in Gujarat, we are working in 60 villages. We are talking about villages plus 212 schools. We are talking about menstrual health management along with the wash. So it is basically connected. Do tell me when I have to stop. So this is how our journey is. So in Gujarat, which is slightly a progressive state compared to now where we are working in Maharashtra's tribal area. Many of you might have heard about Palghar, which is infamous for nutrition deficiency, malnutrition. So we are working over there in tribal schools of Jawar Taluka of Palghar. And we conducted our surveys. We had some interns from Terry, and whatever since yesterday we have heard from different experts, from the doctors, from the myth sessions. These were very shocking revelations, like मुझे लाल बहादुर आ गया है, मुझे मैं डाउन हूँ, लाइक इस तरह का जो भी वहाँ पे निकला है. इवन through our surveys in Palghar, we also realized same thing. But only the little different thing in Maharashtra, what we felt is in these ashram shalas, which are which have daycare hostels also, and girls are staying over there. So government is distributing free pads. Due to total lack of awareness of hygiene, or the upkeep is shocking. I mean, like when I visited few ashram shalas, tears were literally flowing, because on the one side government is investing such a huge amount. So it is like 300 girls multiplied by 12 pads. So it's a big stock given to the all these ashram shalas. So on one side government has done their work beautifully. They have given, they are very clear, hum to de rahe hain. But when you come and see where they have kept, it is a rodent infested pads they are keeping over there. Like I can't imagine, like my male colleague was with me, वो तो सर पकड़ के बैठ गया. I said, how can it be happen? It's such a small thing. It's such a small thing. Or you just give it to the girls and let them manage these 12 pads. I mean, and another thing which has not come out here from any of the sessions is in these ashram shalas. So because due to they're very isolated places, those few of the ashram shalas. The warden of the hostels, she has maintained the record when which girl gets menstruation cycle and all, kind of a record. And then she checks their underwear, under panties, whether she got the periods or not. I mean, this is total abuse of human rights. And then we are asking wardens, क्या reason है? नहीं, वो तो अभी इस उम्र में हो गई है, pregnancy कभी भी हो सकती है. So these were two totally startling differences of what I heard since yesterday. And then at the organization level, we realized we need to get in a bigger way for sexuality, for health awareness, and for, of course, infrastructure is our first priority every year. Out of these 60 school ashram shalas where we had done the surveys, to be very objective with the government, they have done good investments. They have created infrastructure. Everywhere school infrastructure is there. But what do you do when there is total lack of maintenance of those infrastructures? Doors are broken. One of the school where we visited in Hyderabad urban slums, there we saw government has recently constructed a school sanitation, but anti-social elements, they are using those toilets to block, which are very beautifully constructed. So they're using it as a den where they are having liquor in the night. So the thing is, point I'm trying to bring is, like, unless and until we put up a very nice system of operation and maintenance, of accountability of those infrastructure. So government is not able to, neither we will achieve our objectives nor the government is going to achieve objectives. So for the time being, this is what I want to say, and I'll continue.
Thank you, Anita, because you have pointed out very clearly about O&M, the operation and maintenance, and that is a concern for people if you are working in the field of infrastructure development. Who will operate that and maintain that? And it can be misused by other people if it's not governed by its own people, and that's why community mobilization is very important. So sometimes we are just focusing maybe on one area, but a comprehensive approach is what is required today. Even if you are working with Aga Khan or I'm working with Habitat for Humanity India, whenever we are designing, and we need to consider all these aspects, who will take care, operation and maintenance. You also talked about quality of product, which is given in the name of scheme. So maybe it was started with good intention, maybe in the beginning the quality was good, but later on, because monitoring was not happening properly, things have taken a different way. So that monitoring becomes difficult because of lack of funding, lack of staff in the NGO. So that is a concern, and you have very rightly brought it up about the monitoring, about the operation and maintenance of the structures, which has been given to make women accessible to the facilities available. You also talked about that you are working, when we talk about school, what I understand, because I also do SSHE and awareness, one school caters a lot of children. So if you are talking about tribal children, 60 schools, it's a big number. It's a good thing, I mean, you are doing, and we can create wonders if we also educate them on the subject of menstrual hygiene and health. So Sandra, what is your experience, because you are working with different countries and women and health?
Yeah, so I'm so happy to be here. I feel a little imposter because I didn't attend yesterday, so if I say anything, it's because I wasn't here yesterday. Yeah, Days for Girls is a nonprofit that's been working in about 130 countries now. We started in Kenya, and we've expanded ever since. There have been several distributions of our washable pad in India for the past 4 or 5 years. So I know there's been over 6,000 kits distributed in different areas. But as we know, I've been here for about 5 of those. And there are things that are different for India than we found in other countries. Of course, we're dealing with taboos among families, and so it's taken a little longer to get going in India. And that's because of education. I think what you said about you pulled back from one program and you went towards the more education and the more, what did you say? It was great. Awareness and infrastructure. That's what I first noticed when I came. Because of course, if we start just handing things out, it's not effective. We have a 90-minute class that goes with our pads. It deals with the menstrual cycle. We talk about how babies are made. We talk about how menstruation is normal and healthy. So we start by saying menstruation is healthy, is it not? And we ask, if you're not menstruating, that's the problem, right? So immediately we're trying to turn the girls thinking, oh yeah, if I'm not menstruating, that's unhealthy. So that's a little tricky because of what they've heard their whole life about menstruation, right? So yeah, we talk about sex trafficking, we talk about how babies are made, and we do a little course on self-defense. It's all in a very compact education system. And we also talk about, we have a men's program called Men Who Know. So we're doing both in tandem. But we are facing an infrastructure problem. When we distribute, like we had access to 300 government schools in UP and around Agra. And we saw immediately when there's 2,000 girls and there's one toilet and we're giving out a pad that needs to be washed, and that's going to be a problem. We've also seen the same problem with disposables. When we've been in all the slum communities, we see the cows eating used pads all along the streets because there's no place to put them. And even if the government did install beautiful toilets, there's usually a water issue, getting water to those hand washing stations. There's usually an issue with maintenance of the infrastructure. There's usually a breakdown of not teaching the girls how to use everything properly. And if they do have toilets and you're handing disposables out all day, what's the #1 problem you're going to face? Is clogged toilets, right? Is clogged everything. Because that's, haven't you seen that when you've been out in the field? Yeah. So there's all kinds of problems with every thing we're addressing, and that's why we've gone with a cloth pad that's reusable. It's washable. Yes, we understand the girls are embarrassed to hang that to dry. We already know that. We've addressed it in the design of the product. So when they wash out the liners of the product, then they can hang it and it just looks like a square rag. And we make it really dark and busy because we know the girls don't want a big old white stain on there. I know in like maybe 8-10 years ago, I was sewing really big, fat, white, thick cotton pads because I thought, oh yeah, we still need cotton up against the skin because that's for health. Yeah, but I saw all kinds of problems with that because if there's a big white pad and there's a big old stain on it and it's thick, where is that girl going to hang it to dry? How long is it going to take to dry? There's so many issues with that. So we're trying to push dignity. of the individual girl. That's all we care about. We care about individual dignity. So when we approach anything, we talk from the girl up. We just wanted to make sure that girl feels comfortable and safe, knowing that when her period comes, she's not afraid of it. She doesn't think she's dying. You know, there's so many girls that are not educated in the first place. And so it just increases panic, anxiety, all the things that they've already are dealing with, you know. So, and staying in school is like fourth on the list of worries, you know, in the family. So we're trying to, and I joined Days for Girls because of this issue. I was brought up in a wealthy area in the Bay Area in California, in the San Francisco Bay Area. And my parents were divorced, and so we suffered with lack of funds. And my mother was a medical professional, and you would think I would have what I needed, right? Like, I was in a very wealthy area, and that ended up being a problem for me because I had a very depressed mother. I did not want to ask. Just like he said, like, we're not even, if the girls are charging 40 rupees, it's too much. It's too much to ask to even pay 40 rupees because the girl doesn't think she's worth it. So I think it's really helpful when you're teaching about menstrual hygiene is saying what a good job they're doing for the community, what a good help they're being, you know, and how helpful they are. So I think it's just really powerful if we think of the individual girl as not being a burden to society, as not being a burden because of her period. You know, I mean, we can talk problems and, you know, there's so many things, but then the girl feels like a problem, right? She's not a problem. She's a blessing. And we need to keep addressing that. That's all I want to say.
Thank you, Sandra.
Sorry, I was so chatty.
No, it was helpful. And she has brought out two very important points here. One is we are talking about health, and that's why we are here, but awareness is very important. Sometimes even the simple pad which we are giving, any pad you can talk, whether disposable or reusable, maybe the girl doesn't know how to use it. She may use it, you know, the upside down, and she may complain that it was not working, but actually she didn't use it properly. So education, awareness is very important. I have been associated with Days for Girls, and awareness is very, even if you are giving kit, take time for awareness, because that is education, awareness, that is very important. Sometimes what we do, because we get funding, we just distribute things, but it is very important to budget for awareness and education also, because we all are in NGOs, we do with the budgeting and we are confined with budgets. So always budget for awareness and education along with distribution or for the material. So that point was very good. And the other thing which she talked about was dignity. So we are talking about health here, and yesterday we heard that there was a survey done by UNICEF in 2014, and about 70% of menstruating girls, they don't have much awareness about menstruation. They came to know about menstruation only on their menarche, only when they had their first menstruation. So that is the status we have in our country. So, and we're talking about dignity. A healthy body requires a healthy mind. That's what she's talking about. Every girl should feel proud about herself, about her body, and in our education, whatever we are talking, I mean, disposable, reusable, or cups, or sex education, the person should feel dignified. It's not only male, female, but also the male. Dignity is first, and then only a person feels healthy. So we are talking about health. It's the psychological health, emotional health, and the well-being of every individual. Now we are touching upon two important aspects of infrastructure and health and awareness. But three of these factors require a lot of funds. Accessibility. The first thing is that they are not available. Maybe we are working in a pocket of some city or village, but not everywhere. So how we can make these things, awareness or the product, available? I would like to know from our panelists. And three A's are very important in health, that these are available, they're accessible, and they're affordable. So how we can make it, maybe Anita, if you can share with us that how we can make it through your services, what is our takeaway, what is our learning that we can make it more accessible, available, and affordable to them?
So, as far as the infrastructure cost is concerned, we all know funds are nowhere. I mean, very few organizations are coming forward with, and that too when government is saying we have done 100% work, whether it is a ODF level or whether it is a school sanitation level. So these things are becoming slightly difficult as far as the improving of infrastructure is concerned. So how we have tried to, I mean, these are few means to achieve, manage somehow funds for the infrastructure is each school management committee do have some funds, and one school management committee is made aware about improving existing infrastructure, and we have started with just initial investment of 25,000 by improving the doors privacy, which gives the privacy. There may be a broken latch because basic infrastructure is there. So we are looking at it in a gradual manner, slowly. Like initially, if school management committee is saying, okay, we have 5,000, so let's prioritize what needs to be done. So in that process, what happens is, I mean, school management committee also starts owning that unit, and they also realize, yes, if infrastructure cost has been delivered by the government, let's also look into that. It's not a great situation for NGOs because ideally we would love to make our all sanitation units as a very beautiful spots where girls can, go, and the way we have in our houses or in the hotels or anywhere, So it's not a very healthy, but it's some kind of a jugaad, would you call it jugaad or somehow? But in some schools, the local donors, I'm talking purely from the Gujarat perspective. So what we do, like those people who have migrated to Surat, working in the diamond industry, we're trying to contact them. So, bhai, aapke gaon mein aisa school hai. So that is how the local level funds are being mobilized. But when it comes to the area where in Palghar, we find it very difficult to manage the funds because in those schools, even the regular maintenance is just 12,000 rupees in a year per school, which also includes cleaners' salary. 12,000 is nothing. The profile of the community, you can't expect them to do anything. So we, through our own interests and initiatives, we have tried to do, for example, soaps are not there. Let's create soap bank. Soap bank is a very simple thing, You just tell, aaj ek bacche ka birthday hai. Even when I go to the field visits or to any school, for me, soaps are very affordable. So I will also contribute 3-4 soaps in a school. So soap banks have been created. So that leads to next level of result, interest of the parents community. At least they need this. They start cleaning the toilets. So this is, I have really no ready answers as far as the fund mobilization is concerned. I would also dwell upon one more important point, which I thought since yesterday is slightly different in our approach. When we talk about taboos around MHM, we, after thoughtful deliberation and discussion, we have started targeting grandmothers in the villages. Grandmothers who are, they're nowhere in the policy discussion of any politics. They're expected to go to the temple, puja karo, aap log, go to the masjid, whichever religion they belong. So they are only, sitting in one of the corner and giving gyan to their family, do this, do that, and nobody's really listening to them. So we thought, let's target these elderly families who play a very important role in as far as the religion is concerned. So, and for grandmothers, it was like a wow, this is great, and chalo aaj hum gaon mein meeting karenge. So not even one like if there are 30 grandmothers in the village, they all will come in those meetings. And slowly we started talking to them about the menstruation. And as understandable, they will say nahi nahi wo to bada pure impure hota hai, ganda hota hai, puja nahi karte. And when you start giving the rational logical sequences of the, and we thought they have become our great spokesperson. In that process we have thought grandmothers and grandchildren, granddaughters, they have developed a wonderful relationship. And I won't say that doing puja is still no, but other things like entering in the kitchen, the taboos and talking openly about it, it has broken that myth by making these grandmothers a valuable resources in the village. Second thing is, which we are thinking, we have not yet initiated, as many speakers have spoken about the sexuality, adolescent health management, where, in remote areas, in the villages, what in villages, when I was reflecting about my behavior, I don't think I have any expertise to even talk to my daughter. She's just 22-year-old. I won't be in a position to talk to her about sexuality. So, like now what we are planning to do in these 60 villages where we have plans to initiate our MHM is have adolescent-friendly centers. So idea is that wherever you have Anganwadi workers or small PHCs, public health centers, sub-centers, so we will have just designated one corner in that PHC or Anganwadi, adolescent health, friendly health center. So at each village, we are not going to create a new infrastructure, we are only going to add one component to the existing infrastructure. It could be panchayat, it could be something else. And then we can have experts on sexual health management, even MHM. So that is the plan we are having, and I think we are getting very good response. We spoke to the district collector. He also found, इसमें तो investment करनी नहीं है. Only you have to look into the human resources cost. So that's how we are trying to play some kind of a different role in MHM.
Right. So you're talking about incremental and incremental construction, we call it. So that is also when we are doing advocacy and dealing with schools or maybe the communities, we can talk about this, the construction at the stages, we call it. So sometimes it becomes very difficult to convince that how we will construct toilet or how we will add a separate toilet for women. But this is the time that we can link them with loan systems. So we have now loan facilities for, or programs for loans for sanitation facilities where we can link these. So we can have this we can link these people to the banks or MFIs or people who are providing them sanitation-based loans, so that there could be incremental construction, not that one time they have to invest everything. You also added about this soap bank. I really like it because washing hands is again very important in MHM and health. We can reduce our infections and illnesses by 48% if we wash our hands frequently and we know the right time of hand wash. And along with MHM or whatever intervention in MHM we are doing, hand wash need to be need to be told to the to all the target population. It need to be educated. They need to have this education on how to wash our hands with soap properly and when to wash. So that is important, and it is very much related to yesterday's discussion on a pad bank. So we are telling them to give, in the schools, we may have this campaign of pad bank. You donate us a little amount for pad bank, but we can also relate that with the soap bank and promoting hand wash. The grandmothers, again, yesterday there was a play. How many of us were there who watched that interesting street play or play? You were there. So a very interesting character was there, no? The grandmother, she's touching that point. But I hope that in the end, grandmothers are very important because they play a very important role even in the budgeting of the house. That what material will come, whether there will be construction or not, whether we will have money for sanitary pad or not. So that is a good target population for us to educate, or even when we are designing infrastructure. I would like to know from Sondra, how you are making it accessible, how we can make you come here maybe, you know, once in a year, your group comes, or twice. But we want that this kind of material, any material should be accessible to, and if we all work together through different organizations, we can make material products or menstrual related products available to young girls and women. How we can make it, how you are doing it.
Okay, yeah. I'm working very hard at that. So I think the best thing that can happen immediately, everybody has access to it, is the curriculum. Daysforgirls.org has both curriculums, and all you have to do, anybody in any village can get online and be trained as an ambassador of women's health. They can access the education, and then they can go in and have a talk with a grandmother, have a talk with a community leader, and present the education. Of course, when we flip the first chart, there's body parts on there. The second chart is male anatomy. There's sex education, how sperm meets up with the egg. There's hand washing education. So to sit with someone, anyone can do that in any community. So I think that's a real positive, because even no matter how rural I've been, somebody's got a cell phone, right? I mean, somebody has access. So starting with the education for sure is ideal. And then when you ask about, well, we're getting infections, we're getting PID, we're getting all kinds of things going on, and then you can say, okay, well, what are you using for menstrual health? And then we're setting up sewing centers. We have sewing centers in Hyderabad, hopefully Rishikesh after this trip, and Agra, but they're so hard to get going because we're shipping materials around, we're having to do global supply chain, we understand all that, but for the most part, the fabric is pretty easy to come by in India, which is so wonderful. So we know that it's not painful to get the fabric here. We're not importing it from Holland or wherever. Everything you need is here. So as long as you have a 4-thread serger and a little hand crank sewing machine, you can create the kit. And it just matters that you register with Days for Girls, because we do a lot of monitoring and evaluation to make sure things are done properly. And we do link you to resources in country to make that happen. And we provide support if there's any way. That's why I'm here, to support some enterprises that are just getting going, just to make sure they have what they need, that they have a supply chain of getting the materials to these small rural places, and that we start with a big production team. It would be great if we had a big production center. These could go. There has been talk about doing on Amazon.in, doing a matching system where, you know, somebody buys one, they donate one, because as we found, still in the villages, it's really hard to come by 30 rupees, you know, 150. This is usually 150 from the enterprises, but we know that's going to be difficult as well. So CSRs come in, purchase a set of kits for a school to increase their school attendance, and hope for that. And we have seen that affect school attendance. We do have numbers on that, so we know that that's a good way to look at things. As far as getting it to every girl, everywhere, period, which is our theme, that's going to take everybody opening up and talking, just like we said. Right. And I think that is such a beautiful thing that I've seen in the past 4 years in India. I'm so grateful for the movie Padman, because I go into a tiny little village and they go, oh, like Padman. Okay. So that's already opened up just a huge door. And I'm so grateful, because the first year I came, that door was shut. So I see definitely a huge amount of improvement in the past 4 years. So I'm so grateful to see that. And I know there's a lot of progression going. I know there's always going to be hurdles, but let's do it. Yeah.
Thank you very much, Sondra and Anita. So the main points which have come out after this discussion is education, awareness, and infrastructure, along with need-based materials if we can provide to the society.